Alopecia refers to the hair loss from any part of the body, primarily affecting the scalp. It may be localized, diffuse, scarring, or the non-scarring, depending on the underlying cause. Non-scarring alopecia, androgenetic alopecia, progressive hair thinning, male pattern baldness, M-shaped receding hairline, or the female pattern baldness, diffuse thinning at the crown, causes genetic predisposition, androgen sensitivity, telogen effluent, diffuse shedding of the hair due to the disruption of the hair growth cycle, stress, pregnancy, postpartum hair loss, illness, and the medication. Alopecia areata, autoimmune disorder causing double demarcated patches of hair loss associated with the autoimmune diseases, thyroiditis, vitiligo, and the diabetes. Traction alopecia, hair loss from the prolonged tension. Hairstyles, trichotilloma, psychotic disorder involving the compulsive hair pulling, scarring alopecia, rich and panopilariasis, chronic inflammatory conditions, scaling erythema, and the follicular scarring. Discoid lupus erythematosus, localized scarring hair loss with the red scaly patches. Central centrifugal trichatrial alopecia, common in the African population, gradual hair loss starting at the crown. Folliculitis decalvans, chronic bacterial infection leading to the pustules and the scarring. Other forms are anagen effluvium, prescription sudden hair loss during the growth phase, chemotherapy, radiation toxins, tinea capitalis, fungal infection causing the hair breakage and patchy hair loss, pathogenesis, non-scarring hair follicle remains intact, reversible if the cause is removed, scarring, permanent destruction of hair follicles due to the inflammation and the fibrosis. Diagnostic approach, history and the physical exam, duration pattern, associated symptoms, itching, scaling, pain. History of the systemic illness, medication or the stress. Family history, androgenetic alopecia. Scale examination, look for the scaling, erythema, pustules or the scarring. Hair pull test, assess the active shedding. Investigation, trichoscopy, non-invasive magnification tests. Examine the hair shaft and the follicles. Scalp biopsy. Essential for diagnosing the scarring alopecia. Blood test, thyroid function test, autoimmune disease, iron studies for retina, iron deficiency, hormonal evaluation, androgen PCOS in the women, non-scarring alopecia, androgenetic alopecia, ectopical, minoxidil 5%, oral finasteride, spironolactone for women with hyperandrogenetism, procedure, hair transplant for the advanced cases, telogen effluvium, identify and treat the underlying cause, nutritional supplementation. Alopecia areata, topical corticosteroid and the intralesional triamcinolone. Systemic therapy for the severe case of methotrexate JAK inhibitors. Traction alopecia. Avoidance of the tight hairstyle, early intervention to prevent the permanent damage. Trichotillomania, behavioral therapy and SSRIs. Scarring alopecia, early treatment to prevent the further follicular destruction. Medications like potent topical steroids or the calcineurin inhibitor tacrolimus. Systemic immunosuppressants, hydroxychloroquine, corticosteroids. Procedure, surgical hair restoration, limited efficiency due to the follicular loss. Fungal infection, tinea capitis. Systemic antifungals like rhizophulbine or the terbinafine. Topical antifungal shampoo like ketoconazole. Prognosis. Non-scarring types have a better prognosis than the reversible. Scarring types leads to the permanent hair loss if untreated. Androgenic alopecia, most common type, minoxidil is the first-line treatment. Telogen effluvium, diffuse hair shedding triggered by the stress or illness. Alopecia areata, autoimmune associated with the hair, nail pitting and the other autoimmune diseases. Traction alopecia, preventable with the early hairstyle modification. Tinea capitis, fungal infection needs a systemic antifungal therapy. Scarring alopecia, early diagnosis is crucial to prevent the permanent hair loss. Hair pull test, a simple inside test for the active shedding. Biopsy, essential for diagnosing the scarring alopecia. Nutritional deficiency, iron, zinc, and the hormonal imbalance must be ruled out.